Hello everyone, my name is Tracy Farraher and I'm an epidemiologist at the University of Manchester. I use data to explore what factors are associated with health, as well as differences in health between different communities and what interventions work to reduce these inequalities. This presentation is part of the European Public Health Week of the 13th to the 17th of May 2019. Which is led by the European Public Health Association to raise awareness of public health and celebrate healthy populations. In this first ever European Public Health Week, there are a range of events and activities all over Europe, with each day dedicated to an important public health theme. Each day, I'm going to provide a quick summary of some of the evidence of the health benefits for each day's topic, with links to further information. I hope that this provides you with a short introduction to the importance of each day's public health theme. So on the third day of European Public Health Week, the theme is Care for Care, with the motto of the day being taking care of what takes care of you. The sub-themes of this day are prevention in healthcare, self-management of chronic diseases, primary healthcare, health services research, health workforce research, access to healthcare, health insurance, and healthcare reform. We are going to look at the evidence for the health benefits of prevention through modifiable risk factors. Most scientific and health resources go towards treatment. However, understanding the risks to health is key to preventing disease and injuries. A particular disease or injury is often caused by more than one risk factor, which means that multiple interventions are available to target each of these risks. This presentation will look at the understanding of the overall burden of a range of modifiable risk factors. The World Health Organization have collected a range of data from across the world to understand which factors contribute the most to worldwide deaths, and they identified 24 risk factors within nutrition, physical activity, addiction, sexual health, and environmental risks that had a global spread and for which the means to reduce them is known, which are known as modifiable risk factors. You may remember that we saw results from this on Monday in relation to the contribution of physical activity to health with other risk factors. In this presentation, we're going to look at the combined contribution of all of these modifiable risk factors. The burden of disease attributable to risk factors is measured in terms of lost years of healthy life, using the metric of the disability adjusted life year. One DALY can be thought of as one lost year of healthy life, and the burden of disease can be thought of as a measurement of the gap between current health status and an ideal situation where everyone lives into old age free of disease and disability. As you can see on this bar chart, the disease burden varies across the regions of the world, and how much of the lost years of healthy life that can be attributed to the 24 risk factors also varies, the most being attributable to African region. 5 leading risk factors identified in this report: childhood underweight, unsafe sex, alcohol use, unsafe water and sanitation, and high blood pressure, are responsible for 1/5 of all DALYs. Had these 24 risks not existed, life expectancy would have been on average almost a decade longer in 2004 for the entire global population. 5 leading risk factors identified in this report: childhood underweight, unsafe sex, alcohol use, unsafe water and sanitation, and high blood pressure are responsible for 1/4 of all deaths in the world. Reducing exposure to these risk factors would increase global life expectancy by nearly 5 years. As you can see in this bar chart, low and middle income countries have much more to gain than the richest countries. For example, life expectancy would have grown by nearly 13 years in the African region, but by less than 6 years in the high income countries. The 5 leading risks alone shorten life expectancy by about 9 years in Africa in 2004. Thank you so much for your time. Further information on the impact on health of prevention through modifiable risk factors, as well as today's sub-themes, with listings for events for today and the rest of the week, can be found at the European Public Health web pages at eupha.org, including links to my other evidence summaries. To get in touch with me, I'm based at the Division of Population Health, Health Services Research and Primary Care at the University of Manchester in the UK, where I'm also a member of the I3HS Hub that aims to improve population health through data sciences. You can follow the Hub at I3HSH and myself on Twitter at @tfaraher. Again, thank you, and I hope you found this quick summary of some of the evidence of the health impacts of preventing modifiable risk factors useful.